like to think that what we kind of contribute is that perspective that we aren't just an ordinary patient. We're a knowledgeable patient that's looking for patient-reported outcomes that we can include in future research that benefits everybody.
Healthcare professionals, medical professionals, they have medical training, they have medical knowledge, they have scientific knowledge, they have research knowledge, but they do not feel the disease in their life. They do not feel the disease on their body. Phil and I do that.
Our perspectives were often considered and respected, and we were treated as equal partners, really, as partnership within that guideline development. We used a PICO system, PICO system, which allowed us to select which were the most important parts of that part of symptom management. So prioritizing the research is important for us to know and include, The
entire group was collected and with so many differences that it really contributed from a lot of different fields, which makes it a lot stronger.
Yeah, I think it encourages researchers specifically around including patients, because they get, they see the gaps that we encounter within how we are treated or diagnosed.
There are certain areas which there are lots of research, and there are certain areas where there are less research. Example, the effect on coughing, because there are several areas within the guideline which may need more research.
It gave us the opportunity to ask those questions about those things and whether research has been done in those areas. So
it's also true around dry cough and restrictive diseases where opioids are used for. Low dose opioids are often used for cough, but on a broader perspective, maybe not easy to find evidence on a research basis regarding both obstructive and restrictive diseases.
And also it enlightens people, I think, a little bit about the types of devices that are available for people to manage their breathing and coughing.
If I can say something to the GPs out there, ask the question, what else? Because many comorbidities are not necessarily up in the open, and the patient may not necessarily know or think that it is related. But you as a medical professional can make that determination a lot easier, but you have to know about it. So ask the patient.
Yeah, there's a term, isn't there? It's nothing about us without us. And I think that's really what it's about. It's about the whole thing, and the guidelines are just one part of that, and it's important that the guidelines are updated on a regular basis, and that more and more patient information and patients are included in discussion around the guideline development. So it's ongoing, I think.
I love that, Phil. I'm going to steal that. Nothing about us without us.